are we going to be introducing the folks that we have on our CCO as well?
Let me tell people first what. Yeah, this is the order is a little bit funky here. I agree. So, Talk. Why don't you introduce yourself, and then I'm going to show people where to find materials, and then we'll launch into your topics. How about that?
Thanks, Deanna. Good morning, everybody. I love that I'm seeing some familiar faces and familiar names on this screen. I love it. Talk Sonalea Gillespie, she, her, hers. I'm the Director of Community Health at HealthShare of Oregon. And yeah, you're right, Deanna. I have a whole tribe with me this morning, and I'll introduce them later.
Terrific. I do want people to know that we have all of these materials that our CCOs share with us. We make them available to you in group site. And you can see up here, we have the home folder, which is just your, your landing page for group site. And if you click on, actually it's in discussions. Oh, no, I'm sorry, it's in the files. I apologize. This is in the file cabinet. So under files, if you go to regions and then the metro region, there is a folder for CCOs. And we've broken it into Trillium and HealthShare of Oregon. We have some old stuff there from the family care transition, which we should probably get rid of. We're doing a big clean out of group site right now. So, but that's where you can find all these materials. So when you say to us, are you gonna share these materials today? The answer is yes, we will. We can send them in a follow-up email, but we want you to know that we'll post them as soon as, right after the collaborative, our contacts will send the materials to us and we'll post them right there in group site for you. All right, so with that, I'm going to pass it over to, have we decided who's going to go first?
It was Masara.
Okay, so why don't we have Masara introduce her team and show her slides, and then we'll move over to Talk, and you can do your team and your slides, and then we'll open it up to questions for both of you. Does that sound like a good plan? All right, thanks.
All right, great. Thank you so much for keeping us organized with the group site. So today I have, speaking of the tribe, I have Kim Tran, who's the clinical pharmacist with us to talk a little bit about the prescription labels and translating the prescription labels law. And then we have Gino Allen, the supervisor of customer service, Sean Benningoven, the manager of customer service. We also have Lauren Murphy, the business analyst, and Amy Hill, the vice president of network development and contracting. Not all of them are going to be presenting, but all of them are here for, for support and for answering any questions when that comes. We will start with Kim to tell us a little bit about the new pharmacy law about prescriptions. So I'll give you the floor, Kim, and then we'll go to Gino and Sean after that.
Hi, everyone. Can you all hear me? Sorry, I had to take myself off mute.
No worries, we can hear you.
My name is Kim. I'm one of the pharmacists with Trillium, and I was asked by Masara to attend this meeting and just kind of go over the new prescription label law. So the law, ORS 689-564 basically became active on 1/1, and basically it says that the state board will come up with rules that pharmacies can abide by in terms of offering different languages for prescription labels and information inserts, and posting signage in the pharmacy. And I reached out to someone at the State Board of Pharmacy, and she says that law is in effect, but with technology involved and potentially contracting involved, the board is allowing they're allowing pharmacies time to get their technology in check. So compliance cases related to these rules will be addressed individually per the usual board process. And then the different languages that are offered through this law are Spanish, Russian, Somali, Arabic, Chinese, Vietnamese, to name a few. There's a total of 14 languages. I called around and spoke to some of the local pharmacies from the big chains, and a lot of them have, they already have an interpreting service that they use, but some of them are having to spend some time with getting the technology, connecting that service to their label printers or their prescription programs, if you will. And that's pretty much all I have. Do I take questions now or later? I see someone posted something in the chat. Okay, that's Masara.
We can,
All right.
if you'd like, we could wait till the end, Kim, and check in and see if there's any questions. And I apologize, guys,
Sure.
for forgetting to preface that you guys had a little bit to mention about the prescription label program. So thank you so much for being here, Kim. I appreciate it.
Okay.
So I guess that means it rolls into me now.
Right, yes,
Yeah,
thank
and
you,
Sean,
Gina.
I think you wanted to share your
Okay.
screen as well, and you're
Yes,
welcome
please.
to do that.
Yes, please.
Yep.
Let's see, get this rolling here in just a moment. Okay. Can you all see a page that says Trillium Community Health Plan connecting with members?
Yes, we can.
Beautiful. So again, I'm Gino. I'm the customer service supervisor for Trillium, and I'm
Sean,
just going
I'm
to
the
talk a little bit.
customer service manager.
Yep, he's the big guy. I'm the little guy, and that is okay by me. So one of the questions was, how will CCOs reach out to members after how many days, et cetera, and what should be expected? So just threw together a couple of slides to try and cover that a little better. So first off, members that are identified with underlying health concerns get a call within 30 days from one of our member concierge representatives. Within 30 days of coming on the plan, the concierge team member reaches out to them, offers them initial risk screening, depending on what they have as underlying conditions that may move on to a health risk assessment as well. They educate them on their benefits, and then they also provide them with resources specific to their communities. All other members that are not necessarily identified as having those underlying health concerns, they receive an automated call that will lead them to a live representative, and that comes within 90 days of coming onto the plan. One of the things was in the question that I saw was kind of fun. The key really is that they need to press 1. They need to not hang up. It really is Trillium really calling them to really want to help them. And so if they press 1, it will connect them with a live rep. That's sort of the crucial part in that outreach part. Beyond that, each new member receives the new member welcome packet, which consists of a member handbook, which is way too many pages to display here. So here's just the cover. A welcome letter that has their card attached, and it will typically say who their PCP is and give all the different contact information, behavioral health, things along those lines. And then also with that is a helpful resources. And this again is county specific. So we have Lane, West Douglas, and Lynn counties, and then we have tri-counties. And you can see both here, our handbooks and the helpful resources are county specific. And each document that we have also includes on it information as to how they can get that document in their preferred language. And that sort of tied into another question that was presented to us, which was how do we determine a member's language needs? That is pretty basic in all reality, through communication with the member. If they call and they obviously need an interpreter, we get them connected with one. And then also through demographics that are provided to us by OHA. And I put a note on here, OHA's data upload will actually override the information that we have in our system. So though a member can call us and tell us, hey, this is my preferred language, hey, this is my address, my phone number, etc. We can make note of that. But as far as what kind of communication happens with the member in the future, the systems that drive that, that data is driven by what OHA presents us with their data upload. So it's crucial that members update their demographics with OHA, and it's also good for them to let us know as well. One of the points that I really want to drive home is that Trillium will translate any of our documents into the member's preferred language. We had someone who needed an authorization form to speak on a family member's behalf, and they needed it translated into Vietnamese. And so we were able to actually get a rather tight turnaround on that one, which was impressive. It took about 7 days, and so we were able to mail that form out to them. So reaching the members where they are and how best they can communicate is definitely our goal. I did have one other thing just to throw on here. Masara had tagged me months ago about assisters having, certified assisters having some difficulty getting connected in the call center because folks were trying to HIPAA verify them. They didn't have the kind of verifiers we would typically expect. And so a process was made, and I just want to go over it real quick. And this is what our groups have been trained on. Member service representatives are trained to get the name of the organization that the assister is calling from, as well as the zip code of their office. Then they do a certified assister search on healthcare.gov. And if that organization is found, the assister will then be able to HIPAA verify the member, and our staff will work with them to assist that member. And with that process, I suppose we can refer any further comment on it until the questions, but I just wanted to throw up there, how is that working for you guys? I'm hoping it's working well, and I'd like some feedback to make sure that we're doing what we can to best help you all. And then with that, any questions, or do we need to hold those until later?
There's a couple questions in the chat, and I'll go ahead and answer them real quick.
Sure.
So one of the questions is, how will the outreach team know of any underlying conditions for new members? So that happens in a few different ways. When OHA sends us the initial file, there are previous claims are actually attached to that, where we can see if an underlying condition is a member may have, so that flags. There's also, if they were previously on Trillium, there's several different ways that are attached from the OHA file so that we can identify those. It also is if they call in and say, I have this, and that often happens also when they get their welcome packet. They say, I need to talk. So that's another way that we identify that. And what happens with is our initial risk assessment or screening is actually just the tip of the iceberg. That we get you over to case management and get you, there's a lot of other things that go into it after it's identified. And that's something that should be definitely pointed out. If you have health concerns, we will get you a case manager to help you with those. And so that's one of the things that we do. And yes, the Trillium, we take notes, but changes like addresses and things like that are done through OHA. They are our source of truth because they house everything. So when we get the new file, we have the notes, but whatever they have in their records. And if you call in and notice that there's a change needs to be made, my rep will help you get call the OHA and call center and get everything updated. They will not just give you the number and let you do it yourself. They will stay
Exactly right
and assist in anything they can. That's what we're here for. Okay, and then for not all assisters are listed publicly. I'm not sure what the question is here.
Sean, I think that was in regards to the question on how is it going with using healthcare.gov as a method for verifying.
Oh, okay. As far as I know, that we have, I mean, the sisters are, we can only go with what we have, because we obviously HIPAA is, our members' health information is very important to us. So if we don't have confirmation that that is a certified assistant, then we would not be able to release information. I'm glad you have clients that are coming over to Trillium. Martha, we look forward to hearing from them.
I think there might have been a little more to that comment. So
Okay.
I would invite the person who wrote that. I think what I have heard is that some people are being switched to Trillium without having requested it, even when they were on HealthShare, creating a continuity of care challenge. And actually, we have been looking into this, and we have found a reason why that may be happening in some cases. So I'd say I don't feel prepared. I'm on a loaner computer. I don't have all of my notes, except that has happened in some cases. It has to do with merging of data. I'm trying to think. And from the integration of the two systems. And it may have happened at that time, but my understanding is that it shouldn't happen in the future because that was a one-time deal. So we may still be catching a couple outliers in that case, but it shouldn't continue.
Hello, may I say something?
Go for it, Martha.
This is Marta Mesa from Centro Cultural. How you guys doing this morning?
Doing well. Glad to have you.
Yes, thank you. Well, in my personal opinion, it's been happening like 2 or 3 times. Clients contact me saying that they switch to a different CCO. In some cases, it was Trillium, and I have to call the Oregon Health, the customer service line, and then they ask me all those questions like your sister number and everything, but everything there was so nice and helpful. And it's been happening that when people move area or some type of mistake or error on the system, they switch, I mean, for different, and they never receive any letter because they're supposed to live in one place and when they're not. So that's one of the most reasons they are being happening. I mean, the clients have been switching just with no reason. That's what they told me. I mean, on Trillium by that side, but Trillium side, they are so nice too, and they explain to us everything. And I was helping this client as an interpreter as well. So that's why I pay attention to everything, and I apply to my other clients when this happens. So I just wanted to share with you guys. Mm-hmm.
So I just
Thank you for that.
Thank you for that feedback, because I had the fact that that's my team that was talking to you. So that they were and got you all the information is very important to me. And so I guess that's going to be the question for what's the difference between Trillium and Care Oregon. Well, I would choose one over the other. So I mean, I like it's really going to come down to preference, and I like to think that it's going to be maybe it comes down to customer service or the programs you want. It's just going to be up to the individual choice. I think both CCOs are probably great CCOs to be on, and I mean, obviously I'm biased for Trillium, but I will tell you that OHA does not allow CCOs to not provide the best customer service and the best care that they can. So I will promise either CCO will take care of you.
Yes. By other hand, what I've been noticing is that the clinics sometimes they're not cooperating with our clients because they don't take in the new, I mean, this new change, and they don't do anything for them. They just say, oh no, so it's not covering, so you have to go back to the point A, whatever. So they're not really being helpful, the clinics. I don't know if they don't understand the system, or they don't want to help customers. I don't know, but yeah. They
So
totally
Martha,
deny the service. Yes.
Martha, it sounds like, so when folks get, say, switched from one CCO to the other, when they go back to their clinic, they're essentially letting them know that they can't be seen there anymore?
Yes, because they make an appointment and go there, and they say, no, we cannot, because you know, this, for example, this CCO is not cover you. So then, and what I'm going to do is just go back with the lady who helped you to do the Oregon Health Plan. So then that's why they contact me, or I'm pretty sure they contact the other community partners as well, because they don't cooperate. They just say, oh, you don't have the coverage already, or you deny, like, I don't know, so this type of thing. So I think this is from, I guess, the clinics need to be more helpful, and also get more knowledge about what the situation, because you're not supposed to just tell clients, no, we can take your appointment because you don't have any coverage, or it's type thing. So, yeah.
Thank you, Martha.
And Martha, I would also say, if you know of clinics that are having that challenge and you want to let us know about them, that's some outreach we can do to say, hi, we have some resources to help your clients. So you don't have to just tell them, I'm sorry, you're not covered, but let's talk about how we can support you in making sure your clients can figure out their coverage. So I would invite you to let us know when a clinic might benefit from some outreach.
Sure, I can do that. I can contact you with that email. Thank you. Bye.
Wonderful, Martha. Thank you so much. And thank you so much, Sean. I might transition, just to keep us on time, transition us over to HealthShare. So talk if you guys are ready.
Yeah, I'm ready. Sean, how many minutes we got?
We're flexible today because we don't have as much to go over as we do normally. I just want to, it's 10 o'clock now, so just go your normal amount. We'll keep it flexible on our end with some of the slides that we have. I mean, it's important to get their questions, answers from you guys too, so.
Yeah. My normal amount, that includes questions and answers and stories and quizzes. Yeah, but before I get started, I do want to introduce our tribe, our HealthShare tribe. I don't ever show up alone. I got a whole crew with me. We've got Jeremy Kohler. Wave, Jeremy. That's our director of NEMT, non-emergent medical transport. He's our director of behavioral health and dental. And then we've got Stacy DeLeon Davis, our new community health program manager. You waving, Stacy? I see you. Stacy comes to us from Kaiser, and even before that, Family Care. And then I've got Akila Bolden McCoy. She's our THW liaison, comes to us from Central City Concern. And then I've got Allie Birch. Allie, you waving? There you go. Allie is one of our member navigators. And then where is Nancy Thompson? Nancy doesn't have her camera, but Nancy's our other member navigator. So there's us. We're going to keep it simple. So, and then I'm going to invite my colleagues to chime in too. So let me share my screen. That's going to be the hard part for me, but I have faith. Here we go. See it? You see it? Oh yeah. Thank you, Gino. Appreciate the thumbs up. All right. So similar to Trillium, when folks are assigned to HealthShare, they get this document, but you know what? Before I show that, oh my God, how do I unshare? I was supposed to do a quick quiz. Because who was it that asked the question? Was it Lanai or Lene? Correct me. How do I pronounce it? Lanai?
Lene.
Lene.
Looks like Lene.
All right, Lene. Lene Lewis asked the question about Care Oregon, or what was it, the other one? Or HealthShare. So before we go any further, I'm gonna do a quick quiz. So under HealthShare as the coordinated care organization, I saw that Lou helped explain it, but I wanna check in with the group here. Under HealthShare, who are the 5 health plans under HealthShare? We have a family of plans. Feel free to unmute. Because we can't go any further if you don't know our family of plans.
HSU, Providence, Care Oregon. Who am I missing? Those are the top 3 I know right now.
Top 3, huh, Sonia?
Kaiser, Providence.
Yeah.
Legacy's in there.
Thank you, Leah.
Yeah, we got lots of great folks entering it into the chat as well. So
Yep, I see that. Megan, Sarah, Denisha. Denisha, you better know the 5 because you're from Care, Oregon. Yay. All right, so there we go. Now I'm going to share my screen again. And that's really the difference, right? Like Trillium is, and Sean Benninghoven, correct me, right? Trillium is a CCO and a health plan. And HealthShare is a CCO, and we have a family of health plans. I always like to start off with the basics. So let me go again and try to share this screen. Boom. See it?
you are
All
good to
right.
go.
So when someone is assigned to HealthShare, they get this packet. And what I love about it, again, is it's simple, right? It's welcome to HealthShare. And then it lets you know who our family of plans are. And for those who joined in on the quiz, Care Oregon, Kaiser, Legacy Pacific Source, OHSU, and Providence. So folks who are assigned to HealthShare can be assigned to either one of these plans. That little graphic right here. So I'm going to follow the 1, 2, 3, 4, 5, 6, 7. Okay. So we talk about what it does is it explains our family of plans. And then it talks about who a primary care provider is, right? And then that member ID card. For those who've heard me talk about this, you hear me talk ad nauseum about the member ID card and how that is like golden. If you have that card and you know how to read that card, that is a huge start to slowly getting into this very complicated system of healthcare. And then the fourth piece here is about dental. And the fifth piece is about mental health. Sixth one is about prescriptions. And then the seventh one really talks about our hospitals and our specialty. Talks about how to access our services, right? Talks about care coordination there, our prenatal and early childhood services. And then here it is again, that member ID card. And it tells you if you have a question about physical health, you call that number on the back of the card. Right there on that left-hand side, right? If you have questions about dental, it's right there on that right-hand corner. And thanks to prepping with OHA for this conversation with you all, I did a little bit of homework. And I was so excited to find out that we actually have these documents similar to Trillium in, is it 9 or 8 different languages? Hold on, let me look. 8 different languages. We have them in Arabic, Korean, Romanian, Russian, Somali, Spanish, traditional Chinese, and Vietnamese. And again, similar to Trillium, if you'd like to have it in large print or another language, you call the number on the back of the card, our HealthShare customer service, and request that you need it in other languages. I cannot emphasize enough how cool that is to be able to get this in other languages if folks are able to read and write in that language and want it in that language, right? So that's kind of a big deal. Let me see, what else? Trillium already talked about pharmacy, the new pharmacy law, but I do want to go back to what Sean, here, let me go ahead and stop sharing this so I can see folks' faces. Sean Benninghoven, I can never say your last name, Benninghoven.
No, Sean works great.
Okay, so when you're talking about like, who do I choose? And you're trying to share like, what is the best, if you will, CCO, I'm going to keep it real. Like it goes back to what Sean was saying. It's up to you and your needs. Like if you are really connected to your provider at OHSU and you're going to follow that provider because they are such cool people, then you do that. And that would be under the HealthShare network, right? So I think a lot of it has to do with who you want to really care for you and your family. So I just wanted to add that piece, Sean. It's complicated, but also it's really about, what's going to meet your needs. Looking to my crew here. Anything else you'd like to add?
Sure. I always like to ask if folks know what the dental plans are as well, just because they're a little different than the physical health plans. There's also a question in the chat box for us.
You know, I like quizzes, Allie, so we're going to stick to your quiz for a second. Why be on this phone if you can't have fun, right, Deanna? Deanna always makes this fun.
That's pretty funny. I'm sorry, was there a question that you wanted me to answer?
Oh, no, I was just saying we like to keep it fun because that's what you do in these calls too.
Looks like Benjamin and Amy put in ODS, Willamette Dental, Kaiser Dental, Advantage Dental, and Care Oregon were the ones that have come up.
Did they get that right, Allie?
Yeah, those are the 5. They are Advantage, Willamette, Kaiser, Care Oregon, and ODS. So everyone's really on top of it.
Awesome. And the one question that did come through for you guys is where do customers find the info that you shared with us, and how do they request care coordination services?
It's that card, that member ID card. So if they, let's say they're assigned to Providence Physical Health, it would be right there on the left-hand side, and you would call that number and ask for care coordination.
Yeah, I would say that might be one difference, is that at HealthShare proper, there's not a team of care coordinators, but every one of our health plans and our behavioral health plans and our dental plans all have teams of care coordinators that are integrated into those networks. So the care coordination requests are going to go through the corresponding plan. So if it's a behavioral health need, it'll go through the behavioral health plan. If it's a medical need, it go through the medical plan. And then our care coordination teams all work together on really complex cases where there's multiple needs across the board. So just calling the member services number for any of the health plans, whatever the topic area is, the request for care coordination will get you there. There's also most of the websites all have links there as well.
And even Martha, you were asking that question about like out of network, in network. I would call that customer service. And really, again, you shouldn't have to be the one to shoulder the complexity. The folks inside the health system, we're ready and knowledgeable to help you sort through that.
Okay, thank you.
Mm-hmm.
I have a quick question here.
Go ahead, Leah.
Hey, thanks. It's good to see you all. Sorry, I was a little late getting the meeting. I had another unfortunate meeting change from this morning. But so one of the things I want to, I love the idea that I think you folks all shared previously, which is so helpful, the health-related services or flexible services options during COVID. And so, you know, it's just so exciting to see that our customers, if they have specific requests, that they could make requests to either this care coordination team, right? Whatever's going on with their family. And it could have all these huge health outcomes, right? They could be all related to health equity when they make the request, or they could make it to their personal physician. Is that my understanding? If they have something specific that's come up. So I just want to make sure I'm giving our customers the right information. If we have somebody on OHP and they're part of HealthShare, and for instance, they're part of the Providence plan, if they had something that came up with COVID and they needed some specific service, health-related service, or they wanted their family needed something else, we have them call Providence care coordination team itself then, or just call HealthShare and they'll direct it to Providence and the right appropriate team, because maybe it's not a physical health, maybe it's a mental health, maybe it's something else. I want to make sure I'm doing it correctly.
Yeah, I think there's there's a few different paths into requesting health-related services. First, most commonly used path is actually from the provider. So oftentimes the member will have a conversation that could be a primary care provider or it could be a behavioral health provider. And then the provider will then submit a request on behalf of the member to the health plan. So it could be, like in the Providence example, it could be a Providence primary care provider might then submit that to Providence for a health-related service request. Or if it's like someone in case management at Cascadia Behavioral Health, Care Oregon manages the behavioral health benefit, and they've made those flex funds available to behavioral health providers. If someone's not attached to a provider and has a flex fund request, typically that then is done through the care coordination team. So someone would want to call their health plan and talk about care coordination resources and what the needs are there. Care coordinators can help facilitate that process, but I would say probably the majority go through providers.
Yeah, it's just really sometimes, you know, I think it's so exciting, first of all. So I just want to make sure I'm giving our customers the right information. So in terms of health related services or flexible services options, they really should talk to their primary care physician if they have one assigned at this point to make that request. And then that physician then coordinates with that care coordination team to make those things happen if they can.
Yeah, or their like I said, or their behavioral health provider.
Right.
Behavioral health providers are really well connected to flex services.
Okay.
Or if they, I was gonna say, and if they do have a care coordinator at the health plan, that is another really good way. So if they're in any kind of active care coordination services at the health plan with any of the health plans, that would be another good place to go as well.
Yeah. And the other question I have is a follow-up to that. So I know when you guys did this presentation, it's been many, many months ago, about health equity and outcomes and the social determinants of health. And you had money specifically set aside for COVID and these health related services and flexible services options. Will this continue past COVID? Will this bigger framework of health equity and social determinants of health and getting into those communities and the folks that need those services, will that also continue past just something COVID specific, the pandemic? Do you know that information? I'm just personally curious.
I mean, certainly the flex related services program, health related services, flex services is permanent and ongoing as part of our CCO contract. So that won't go away. I think during COVID, there's certainly like an expansion and more resources were certainly made available to address like a wide variety of needs, but I don't see any of that changing. And it's part of what we're required, all of us are required to do as CCOs.
And I agree with Jeremy, same thing at Trillium. We, flexible services are to improve the health of our members. So during COVID or not COVID or, whenever, having that communication with with providers and care coordinators and we even add the element of community health workers into that, because the community health workers have that knowledge of lived experience and of the community and of the specific members' needs. So that whole process and that, and flexible services are something that are ongoing. And we want to make sure that we, if folks need us to present again about flexible services, please let us know. We can do that again and clarify some areas on that as well. But really, flexible services are very important in terms of covering some of the needs that are not covered by the health plan or not covered services. So yeah, let us know if you need another presentation about it. We're happy to do it.
So guys, well, I'm just going to trying to keep an eye on time here. I know maybe a few more minutes for questions. It's already 10:17. But I just wanted, I know Barry had his hand raised for a little while. So Barry, I wanted to check in and make sure that you had a chance to speak if you still have a question. Feel free to unmute yourself. And if not, that's totally fine. I know I've many a time raised my hand accidentally. So if you don't, that's also cool. I just wanted to bring things back a little bit. You had something to mention as well in regards to that welcome packet and those first things that folks receive in those first steps to kind of initiating people's care. I know there are many times where information is not going to get shared with the CCO, say someone's past dialysis clinics that they've been going to or care that they've been seeking previously. I just wanted to check in, roughly what's a timeline for, for things to come in the mail? Should CPs encourage folks to, because I know that you'll get enrolled in Trillium and HealthShare before you get something in the mail. So folks can kind of take a step to take action on their care, like setting up their PCP or changing their health plan on HealthShare if they needed to, before they even get their packet in the mail. So how do you guys encourage folks to make sure that they're taking actions earlier to get their customer care taken care of when they're first enrolled?
Can I ask my question now?
Oh, go for it, Barry. Yeah.
I wanted to ask you, how do we change the dental plans for the children? And is the only plan that we have the Advantage Dental here in Portland?
That's a great question, Barry. So I know that we've gone over, if the client's on HealthShare, there are 5 different dental plans. And you would want to call into HealthShare's customer service, the client would, to see if they're able to change their plan. And it looks like we had answered earlier that they can change their dental plan once every 12 months.
I've only seen one plan, which was the Advantage Dental, and they've never been allowed to change plans. I didn't know that they could, and to who it could. I know you can change the health insurance, but I wasn't sure you could change the dental.
Yeah, you should be able to change both.
Okay, thank you.
And I apologize, Talk. I'm not sure if you wanted to add any more to that.
No, my hand was up earlier. Just wanting to thank Leah for her question. And I just wanted to add, I don't know if folks remember, but when you talked about health-related services, I want to just emphasize again what Jeremy said, and it's a both and, right? Aside from health-related services, we as a CCO, both Trillium, and I'll speak for Trillium here, and HealthShare, we are so committed. We have to be, even outside of the CCO 2.0 requirement, we have to be committed to ensuring that particularly communities of color who are impacted by our oppressive, structures are receiving the care that they need. We already know based on the data that those communities have significant disparities. So I just wanted to say, this is so beyond health-related services. We have to do better.
So one of the things I just wanted to, Sean asked earlier, how before you get your packet, how do you get some of these, care coordinator? How do you call our customer service? That's what we're here for. I have reps that will answer the phone within 30 seconds and they will get you to where you need to be. And their job is to take care of you, and we will take care of you. That's how we, so just give us a call at any time, even if you just have what benefits you have, or you not sure what CCO, we would be more than happy to answer your questions.
And what I would add to that, Sean, and while we portray like we are the hottest thing on earth, I really want to make sure that when you're calling customer service and you're not having that experience, please let us know. Like Deanna and Sean and Liliana, feel free to share our information in an email, because that's the thing, right? Like we might think our stuff smells great, right? But because we're not hearing from folks that are having challenges, so please call us and let us know if it's not working out that way.
Absolutely.
And to Sean's question, let's try it out, right? I just got hot off the press from our communications team. I said, could our community partners and assisters get a sample or a real one of the new member packet mailed to them? And they're like, yeah, we would be happy to send out a new member packet to any of our community partners, any of our sisters, so they can actually see and touch what is actually going to be seen and touched by the members. So yeah, reach out to us and we will send a real packet to you. And this again goes back to Sean's question, like, let's see how long it takes. Did it take a week? Did it take a month? Let us know. So happy to do that, and try asking it in different languages. See what that does. Test the system.
Chuck, I have a question. I actually tested the system, I would say, in that way. I called in the customer service for that CCO that you work for.
What is that CCO that I work for, Perry?
It's or maybe you don't work for, but it's.
I do, but what is that CCO?
The other one besides Trillium.
HealthShare.
HealthShare. So I called in on behalf of a community member that wants to change the provider from OHSU to Kaiser, because she's been going to Kaiser and she just want to maintain that relationship. and they said that they need to get an interpreter. And I actually told them that I'm a certified health worker if I can just do interpreting for this person. And they said no, we need to get some kind of ID, like what
I think they've
organization you work
already
for and stuff
passed.
like that. So yeah, I just want to mention that it's not I don't want to like put the impression like a negativity on that, but I just want to share that since you talk about that.
Yeah, no, Perry, I appreciate it. And I love that you're doing it publicly, right? When we talk about holding CCOs accountable, this is what it looks like. Putting it out here so that we can step up our game. I just want to mention the interpreting piece. We are right in that. And I think I could speak for Trillium here too, Sean. If I'm stepping on your toes, let me know. You know, we THWs should not ever be asked to interpret. That is not their role. We should not put that burden on you. We are all required to ensure that we have professionally trained, certified, qualified interpreters to step into doing that work. So there's that piece. But if that situation hasn't been resolved, I've got Nancy here and Allie. I even got our director of who supports them. You reach out and then let us know so that we can resolve this issue of switching that person over from, I believe you said Kaiser to OHSU.
Yes, of course. Thank you.
Yeah.
Actually,
Thank you, Perry.
from OHSU to Kaiser, actually.
Yep.
Yep. Thank you.
You are so welcome.
That is,
Often you need help.
but that is for us also. If you need a translator, if you just need somebody in the office with you that speaks another language, because you're not, we will make sure you have somebody that goes to the appointment with you. We'll translate any paperwork you need. We will get you a trained translator on any phone call. That's across the board. You shouldn't, just because you don't speak a language doesn't, or aren't proficient, will not affect your quality of care, hands down.
Thank you, guys. And I saw Travis had a question as well. Travis, did you want to go ahead and ask your question?
Sure thing. I'm sorry I can't seem to get my video to work. I've got some webcam issues. But so hi, my name is Travis Small. I'm a wraparound services case manager. I work with folks in low income and subsidized housing in downtown. I've been doing case management for about 5 years or so, and a sort of consistent theme that I'm seeing that is problematic isn't just connecting folks to care, it's reconnecting folks to care. So those folks who have been assigned case managers, they've already been assigned to therapists who may have moved in and out of network. But a big issue is often just communication. We have folks that, maybe their Obama phones get lost or stolen. Maybe they're experiencing some kind of cognitive impairment. I think a big issue is that, a lot of this is sort of predicated on their own initiatives or capabilities, being connected to a case manager and the like. So I guess my question is, does Trillium or HealthShare have any kind of initiatives or positions with field agents who will literally go try to meet with folks where they're at to try to reestablish care, to look at last known addresses, potentially access last known phone numbers, but to really and truly go the extra mile to close that gap? Because it seems to me, a big theme in Portland and nationwide, of course, is, the mental health crises that people experience, and that, almost every study and the like seems to indicate that a more proactive tone rather than reactive triage-based care is in our long-term best interest. I work with folks all the time. Some unfortunately have experienced extreme tragedy because they weren't connected to care in time. And, it is something that taxes the social services network on an emotional basis, on a financial basis. Yeah, I guess that's just sort of my question. Is there any kind of initiative or plans in the future for, insurance companies to really take a more assertive tone on that front?
Thank you, Travis, for your question. And I totally agree with you. I come from a background of working with refugees, and I'm a refugee myself. So I've been in that situation where I haven't been connected to services and trying to reconnect it was also an issue for me and my family. But I think to answer your question in terms of what we have, and I will speak for Trillium, what we have in terms of going out in the community. So in Trillium, we have a group that is formed of community health workers. We call them member connection representatives as well. And their role is basically to go out in the community and try to connect and reconnect with members that we have lost their phone numbers or can't connect with them in any way or another. We are trying to have more staff in the tri-counties now that we are, starting to see these needs in here. So, so we do have that program within our CCO. And we have actually used it a lot during COVID and also during the fires in Lane County area and Douglas and Lynn. In terms of also, talking about holistic care and reconnecting to services, we also contract with community-based organizations that do provide that reach out at the community level, reach out to homes, community organizations that, that really have community health workers, have peers, have personal health navigators, doulas, that they are basically going out to the homes and connecting with people. So if we don't have folks that are on the CCO level, we have folks that we contract, we have community-based organizations that we contract with to work with us to reach out to these members. So we do have that kind of like holistic approach to make sure that we are reconnecting, we are addressing these needs, and our care managers, in different departments, if it's, people who are pregnant or people who are experiencing homelessness or, or people who need support with behavioral health. We do have all these different programs that will be able to work with our community-based organizations to reach out and reconnect with folks. I hope that answers your question. And we're always, taking feedback. I think that's really important. We always want to hear if that model is working out, if this model is working for our members and for our community partners, because you're basically the ones that we are working with. You're basically the ones that are, you're our eyes and, and our legs in the community.
Sure, absolutely. So I guess just a follow-up question, these member connection representatives, when did that program get off the ground?
We've had that program in Trillium since Trillium started. Trillium became a CCO in 2012, and before that they had we were an organization and we had that community health workers program. And when we became the CCO, we developed that program into a member connection program. But the people who work within that program are community health workers. So we've had that program since inception for Trillium.
Okay, well, wonderful. So that does sound sort of like exactly what I was sort of getting at. I guess my only feedback would maybe be just to increase your numbers. I've been doing case management for 5 years, and this is the first I've heard of it. So,
awesome.
I think if you folks are really out in the field, really pounding the pavement, that yeah, that's I'd love to continue to work with you.
Yes, and I will connect with you afterwards.
Awesome, guys. So I know that I want to try and keep us on time here. I know that we're run a little bit longer than normal, but what I really love is I just want to say I'm already excited that we've moved to Zoom because we've had more people talk, more people engage than we've had in a while. Travis, thank you so much for your question. I actually really feel along the lines of what you're wanting to continue to discuss as well, along that care assessment and getting people connected and helping to reconnect people to care if they do get disconnected. So I know we usually have a slide that asks you guys what you would like to have as your next topic or next question for CCOs, but I think we probably could continue this topic farther. It really seems like we have people have a lot to say, a lot of questions that are coming up. If you guys have more questions that you're not able to ask today, please feel free to put it in the chat box and we'll try and get them to the right folks for Talk and MSR to reach back out to you guys. But CCOs, I just want to thank you guys for having extra staff here. Thank you to everyone that presented. And I think this is a really great start because I think, I've been having some of those questions as well. It's like, how do I make sure our systems are still very client oriented in saying you are an individual, you need to be the one to call in and get what you need. So, how can we work together as a community to make sure we're bridging that gap for folks that maybe they aren't able to do that on their own, or maybe they're struggling to reach out and get the care that they need or the languages that they need. So, Travis, I think you brought up a really, really, really great question, a potential gap for us to work on solving together. I also want to let you guys know that I have one of our innovator agents here as well to present to us a little bit later today. And they're also part of that process of working with CCOs and OHA to solve larger problems. So if we're seeing systematic issues or we're needing to be breaking down barriers, they are another great resource to be working with the CCOs and working with the state as well. So maybe that's something where we can bring in that conversation too. So I want to try and give you guys as much resources as possible, but also that we're following up. So I don't know, thank you guys so much for all that you had to say and all your questions. And I'm saving the chat as well so that we can try and go back in if there's anything we didn't follow up on as well. Does that sound okay for everybody?
I just want to throw out, we put our customer service number in the chat. So anyone that has a question that maybe doesn't get answered and really has a burning desire to know today, they can call the customer service number and they can actually ask for Gino or myself and we'll take care of them.
Awesome. Thank you so much, Sean. And thank you, Gino, too. All right, guys. So Deanna, do you want to go ahead and start sharing our slides again? And I will go ahead and pause our recording.
Do that.